Now, 3 countries have suspended AstraZeneca COVID vaccine amid serious side effect concerns. The 3 largest EU countries, Germany, Italy and France, all of them have paused the rollout of these vaccines on Monday, which is the Covishield vaccine developed by AstraZeneca and Oxford University, and all these states were later joined by Spain, Portugal, Slovenia and Latvia. These nations have for the moment halted administering these vaccines. There have been a number of cases in Europe of blood clots that are developing after the vaccine was administered. The World Health Organization has urged countries to not pause COVID vaccination, urging people to not panic. It said there was no evidence of a link between vaccine and blood clots. The Indian version of Oxford AstraZeneca COVID vaccine is known as Covishield. Following the suspension of the vaccine by several countries, the central government has decided to conduct a deeper review of the post-vaccination side effects from Oxford AstraZeneca coronavirus vaccine. As the world's largest COVID vaccination drive is underway in the country, India has nearly administered 3 crore cumulative vaccination doses.
Several more countries have suspended the use of AstraZeneca vaccines as a precautionary measure after reports of blood clots in people who had received the vaccine from 2 batches produced in Europe. This does not necessarily mean these events are linked to vaccination, but it's routine practice to investigate them. And it shows that the surveillance system works and that effective controls are in place.
Milan Sharma is now joining us live for the very latest. Milan, this is a scary situation when you've got several key countries in the European Union going on there to halt the administering of the Oxford and AstraZeneca developed vaccines. What more can you tell us in terms of the precautions that India now needs to take on the back of this particular news coming in?
Well, good morning, Chetty. And certainly this kind of news will raise some concerns for India as well, because we are using Covishield, which is a vaccine created by the Oxford University as well as AstraZeneca and the Serum Institute of India. Well, on the Indian government side, I'd like to tell you that there have been meetings of the adverse events following immunization committee that was held last week, in which they were sifting through cases of adverse events that may have been seen in people post the administration of the AstraZeneca vaccine, Covishield, in India. But government sources have informed that as of now, they have not seen any cases of blood clots in the Indian population that has been vaccinated, Chetty. So in a sense, that's good news through India. But there have been rising cases of blood clots where people have reported these as adverse events in all these European countries, along with Thailand being one that has suspended the use of AstraZeneca vaccine. But we also heard how WHO has been saying that no causal linkage with the vaccine has been found of development of blood clots. In India, yes, the adverse events following immunization committee will meet again this week to sift through many more adverse events that are being reported post-vaccination. But blood clots certainly is not one of them at this moment, Chetty.
Absolutely. Blood clot is a bit of a concern right there. And what kind of review and preparations is India going to make now? Because there is a review committee as well who's going to be deep diving into whether there is a linkage between blood clots post the vaccine administration. Because see, there are just so many people in this country who have already taken the shots.
Absolutely, Chetty. In fact, all of those who have taken the shot have been told to report any sort of adverse events that are being seen. At this point, from the ministry sources, I have figures of about 232 such events that have been reported. They are adverse events, but they have not been of, of the blood clot nature that is being spoken about with regards to the AstraZeneca vaccine. Deep vein thrombosis has not been seen in any of the patients, any of the people who got vaccinated. Although we cannot at this point certify that these adverse events were after one took Covaxin or Covishield. These are combined numbers that the government has, but certainly
Dr. Pratik Samdani, who is a COVID specialist, he's one of the top doctors in Mumbai. He's joining us on the phone line on all these concerns. Very good morning, Dr. Samdani. I appreciate you taking time out of your busy schedule to address this very specific 2 questions. It's a matter of big concern. The first question, of course, is on these countries in the European Union who have gone ahead and halted administering these vaccines that have been made by Oxford and AstraZeneca on the back of some evidence arising of blood clots that have come up after the administering of these vaccines. How do you respond to this, and what is your sense? Is there a deeper dive required into this?
Good morning. Thank you very much. So, yes, I am aware that several countries have halted the administration of AstraZeneca, especially for the next 2 weeks, the vaccine that they have manufactured. And this is because of an incidence of thrombosis in the European population. Now, I have 3 caveats to this. This is under interrospection. That means they're going to get data to relate and clearly find out if this was related to the vaccination. Number 2, if you see the percentage of people, it's very, very minuscule. Number 3, COVID-19 or the SARS-CoV-2 virus is a prothrombotic virus. That means it is known to cause some amount of thrombosis. That's why most of our patients in hospital and OPD are on blood thinners to prevent this thrombosis. The incidence of fulminant thrombosis or death caused by thrombosis is very, very low if treated adequately. So I feel that there needs to be some introspection, but I see no reason at this moment to halt this vaccination drive in Europe. Genotypically and phenotypically, Asians are different from Europeans and Americans and the other parts of the world. So we have a different makeup. I think we've vaccinated a large population in our country, and there is just absolutely no evidence to say that this causes thrombosis.
Oh,
so I would have
fantastic.
my reservation. I would have my reservation to say we should follow suit of what Europe is doing in India. We have evidence to say all of us have been vaccinated, and most of us have been vaccinated. When I say all, it's for the healthcare workers by the AstraZeneca, and we are all safe and alive.
Okay, that's great. That means everybody can go out there and get themselves vaccinated in India at least. And for our viewers, this is going to be very good news, Dr. Samdani, for clarification. But stay on with us, because we also received this one concern from another doctor. I do not know if I'm at the liberty to take the name of the doctor, but I'm going to go and shoot across the question to you. There's a very senior doctor who ended up testing positive despite taking both the shots of the vaccine. There were neutralizing antibodies of 250 plus for one of the doctors, but do you feel that the vaccine is less effective?
So here it is. The data tells us there's a protection from 66 to 91%, and this protection is conquered by saying prevents severe SARS-CoV-2 infection. There is no guarantee or 100% protection from any vaccine for any disease across the world. Even the flu vaccine gives you protection to 70 to 75%. So, I mean, just because we've got 2 shots, we've got neutralizing antibodies.
Absolutely. Dr. Samdani, I'm just coming to you.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel, and don't forget to press the bell icon to stay updated.